I'm Dr. Laura Shaheen, and I'm the director of the Center for Recurrent Pregnancy Loss at Pacific Northwest Fertility. The Center for Recurrent Pregnancy Loss is very unique. Reproductive endocrinologists are the experts in recurrent miscarriage, but there aren't a lot of physicians or even reproductive endocrinologists that really dedicate themselves to miscarriage. And the reason is it's not black and white. It's not as easy as walking into a doctor's office and being diagnosed with high blood pressure and walking out with a pill that's going to fix it. 50% of the time we don't find an answer. When we do find an answer, we can address it, but it's just not perfect. It's a very gray area of medicine. There's a lot of research that needs to be done. There's a lot of questions that are unanswered, but I'm okay with that. I'm comfortable with that and providing supportive care and doing everything we can today to evaluate and treat people and help them start their family. Coming to the program, it's usually at least 2 visits. So the first visit, it's about an hour visit with me or one of the providers here, and we take that time to go over the patient's history very carefully, ask questions, review the losses, take a full history. And that first visit is a lot of talking, and it's a lot of education and teaching. We don't usually do any testing at that first visit, but we go through the testing that we want to do and make sure the patients understand what we're doing with the next steps. The testing takes about a cycle, and it's really blood work and some anatomy testing. So we're looking for any reason why somebody might be having miscarriages, whether it's something with the uterus anatomically, whether it's hormonal imbalances, immunologic issues, and anything that we can find. But I really teach people at that first visit that 50% of the time we're not going to find an answer. We're not going to find an issue with the woman or the man that is trying to get pregnant. And the reason is because the most common cause of miscarriage is something within the embryo. It's usually a genetic issue within the embryo that has nothing to do with the woman or man that's conceiving. It's really unique to that one embryo, and it's really, really bad luck that can happen. A part of the program is really looking to see if I can find a thyroid issue or a uterine septum or something that I can address with patients. But very often at that second visit, that return visit where we're going over all the test results, I very often say, listen, this is unexplained recurrent pregnancy loss. More than likely, it's something going on with the embryo. The options moving forward, if you get diagnosed with unexplained recurrent pregnancy loss, is very extreme. 1, you just try again, and the very next time you conceive, you can have as high as a 50-60% chance of everything going right, maybe even higher. The only thing that I could offer that's an active treatment or something to decrease someone's risk of another miscarriage, if we assume it's a chromosomal issue in the embryo, is to test the embryo before that person conceives. But that requires IVF or in vitro fertilization. And so that's a really interesting conversation to have with people. I can't find an exact reason why you're having miscarriages. It's most likely something with the embryo. And either we're just going to try again naturally with really supportive care, and we take really good care of patients here through their first trimester, or it's IVF. Every patient is different, and every conversation is different, and it depends on the patient's age and their history and a lot of other factors, how I help guide people through that decision. But it's really a partnership. It isn't me telling somebody what to do. We kind of come to that decision together. I really think one of the most important things that I can do is help people restore faith in their body and themselves. They come to me feeling broken, that they can't carry a pregnancy. And women are so good about making themselves feel so guilty about every little thing, a drop of caffeine, a glass of wine, stress, etc. And I really want to help them do an evaluation, learn as much as they can about the causes of miscarriage, and find the strength and encourage them to keep trying.